Meet Linda. She is a 45-year-old woman. She was admitted to the hospital with pneumonia and breathing complications. She's feeling better now and wants to go home, but she's also scared. She does not fully understand her medications and she does not have anyone at home to help care for her. Linda receives the news she was waiting for. She's medically ready to go home. But even after discharge is approved, she waits for hours for paperwork, medications, transport, follow-up reviews. It is a lot to process. And when the instructions finally arrive, they come all at once, leaving Linda confused and overwhelmed. At home, Linda realizes she still has questions and she does not know who to contact for help. And then the unexpected, a warning sign appears, but Linda isn't sure whether it is normal or urgent. And sadly, for Linda, without timely support, a preventable risk becomes a hospital readmission. But there's hope. One intelligent discharge process can help Linda next time with a guided recovery support.
And yes, there is hope. And that is the reason why we have built CareBridge AI, an intelligent patient discharge system, completely built on UiPath Maestro. And with CareBridge AI, we are offering a one-stop solution where basically we are taking care of all the part that happens right from the intake process to the part where a patient gets home safe and fine. And also we are able to do things beyond it. So using the best of the technology, we are offering a solution through which a patient can get recovered better and fine in the comfort of his home. With that, let's begin. So the journey starts when a patient is identified as potentially ready for discharge. So in the background, CareBridge AI, it retrieves the patient data using RPA from the EHR, and it goes ahead and normalizes the patient data. And here is the part where it basically validates if all the required fields are present and all the different data along with the patient. And also this part, it verifies the insurance snapshot if everything is looking good. And once all these checks and balances are complete, it goes ahead and creates the case within Maestro. So next part it comes is the readiness assessment. It is one of the important part because there are like a lot of checks that has to happen, and usually in this step it has to go through like a lot of unstructured notes from the clinical and from the medication, and it has to make sure like we are all covered. So basically we have different agents. So we have the validate clinical readiness agent, which basically checks clinical indicators if everything is looking fine, and we also have the medication review agent, which reviews all the medication readiness checks. And at the end, if anything is like a gap or anything like that, it will come to this action center interface where basically a nurse or doctor, they can review what is missing and they can take the necessary steps. So next comes here is the part where we are generating the discharge plan. So usually here we have to get information from multiple different sources. It can be from the clinical notes, it can be from different places within a EHR, taking the information from the doctor, from the nurses and physician, right? Like basically what should be the next set of medication that they have to take, like what will be the next kind of diet they have to follow, right? And when should they take a like a next appointment, and in a case of emergency or in a like a out of the case scenario, like what are the steps that they have to follow. So basically by capturing all these different thing, and basically this will vary by case basis. So once we have all the different information, an AI agent should be able to analyze them, use the best of its ability, and should be able to draft a plan. Now, once the plan is ready, it basically gets sent out to the care team, uh, and they'll be responsible for reviewing it through an action center interface. So basically, like all that is needed will be coming here, and if everything is looking good, then they can shoot approval, and with that, it goes into the next phase. So in this phase, it is one of the last step here, which is basically required for making sure that we are sending all the information to the patient. That involves all the different artifacts. So here is we are sending through Google Drive, and this is what it is like a patient plan document. Contains everything basically what we are looking into. Then finally, it also arranges for the transport, and it sends out a message to the patient and also to the caretaker. Then after that, here is we are not stopping, we are going beyond that. So once the patient has reached home back safe, we are initiating a guided recovery part where we'll be sending like frequent follow-up, right? If everything is looking fine, and at the end of the day, we'll be like sending like what they have to follow for the day in order to make them all right. We'll be giving some good nudges in between so that they can feel motivated, right? And this is like our out of the box capability that really stands apart. So we have built a complete coded app through which like a patient can track all that day to day, like the vitals. So basically, here is where we are integrating with the variables, and also here we can see like a conversational agent that is built, and that is really grounded up onto the patient documents through which. So as you see, this entire solution has been built on UiPath Maestro as our orchestration layer, and there are like many things that I've used in the backend. So that includes API workflows, RPA workflows, UiPath agents, the coded agents, and also if things are lightweight, we have made use of function. So with that, we conclude our demo on CareBridge AI.